With more than 50 years of service to the Downriver community, Oakwood Southshore Medical Center in Trenton is proud to provide trauma and emergency services, cardiac care, and more, delivered with world-class customer service.
Oakwood Southshore Medical Center is a 193-bed hospital located in Trenton, Michigan, right off of 4th Street. We have 900 employees, and we have over 200 active members of the medical staff. When you come into this hospital, we want you to consider yourself as part of our family, because we consider you part of our family, and we will do whatever we can to make sure that stay meets your needs, and we'll look for ways that we can go out of our way to make sure that the service here is excellent.
If someone thinks they're having a heart attack, if they're having chest pain, indigestion, any back pain that's pretty strange to them, they should call 911 immediately. And if the diagnosis is a heart attack, that patient will be brought immediately to the emergency room, but they don't really stop there. They'll be brought directly to the cath lab where we can open up that artery and get that blood flow going. Basically, in some cases, we expect the emergency on-call team to respond to the hospital and get here before the patient even actually gets here. Time is muscle. Get that artery open as quickly as possible. Save that heart muscle.
Oakwood Southshore Medical Center became verified as a Level 2 trauma center in January of 2011. We are the only verified trauma center in the Downriver area.
There's a wide array of reasons that a patient would come here. Certainly the gamut of injuries, motor vehicle crashes, assaults, sports injuries, football injuries, things like that. Anybody who's actually injured, you'd want to come to trauma center.
As the surgeon that's on call for trauma, I have to physically be in the trauma bay taking care of the patient within 15 minutes of their arrival for the sickest patients, and shortly thereafter for the patients that are less injured. So when we're on call, we're dedicated to this hospital, and oftentimes we're in the hospital for 24 hours covering that call. And so you've got the attending surgeon that has the expertise readily available. It's a state-of-the-art facility with top-notch equipment, and we also have top-notch physicians that are meeting all the standards of care that are set nationally, and that's the bar that we're held to from the trauma services as well.
We pride ourselves on our patients coming first. That's our credo. We are here to take care of patients, whether it's a cut finger or they come in as a result of a major trauma on one of our freeways. We have all private rooms in the emergency department, not separated by curtains, but separated by hard walls, so patient privacy is really taken into account.
Oakwood Southshore Medical Center is a full-service community hospital. We provide all the services that the community may need when they're looking for health care.
We provide a full complement of surgical services: ophthalmology, OBGYN, orthopedics, and we're very fortunate to have some of the latest technology to be able to do endoscopic procedures and laparoscopic procedures. The surgery center is designed with the patients and their families in mind. The patients are prepped in the same room that they return to post-procedure, so they can recuperate there and their family can join them. And it provides a great deal of comfort to the patient and provides opportunity for privacy.
Oakwood Southshore Medical Center is ranked in the top 10 percentile in the country in delivering patient care and service. The Prescani Award that we won signifies that we do the very best that we can because it's important to the patient and it's important to the hospital.
I find the atmosphere here at Southshore to be very welcoming. We know that the patients who come here, when people come to receive care at Southshore, most of them are frightened, anxious. So we try to be very welcoming and sensitive to their needs. We try to exceed their expectations always. We see ourselves at Oakwood Southshore as being very fortunate to deliver care to a community in a facility that's beautiful and has the greatest technology, expertise, and medical knowledge to meet the needs of our community is a wonderful thing.
Medical education provides an opportunity for us to sort of stay on our toes Students challenge you, and they challenge you to do different things, or they ask questions, so that's a wonderful thing for us.
I think the benefit of having a medical education program is that it elevates the excellence of the healthcare in the institution. You have more eyes looking at the patients. Also, the students in residence, they bring more up-to-date information, because busy physicians, even though we go to seminars and stuff, there's a lot of new information coming out every day, and the residents bring all this new information to the attendings, and the nurses and the physicians and students, residents, ancillary staff, they all collaborate together. It's more of a team approach.
As we look to celebrate our 50th year here, I think it says to the community we're here. We've been here for 50 years, and we plan on being here for another 50 years and longer to provide service to them.
It's a community hospital. This is the hospital that we all go to. This is our hospital. This is where our families come, and our neighbors.
I feel that we are a team at South Shore. We're all committed to the Oakwood mission, and that is to provide excellence in care, healing, and health to the individuals and to the community we serve. And I really feel that the employees here buy into that and are committed to making the patient's experience the very best it can be. Every patient, every time.
For more information about the services Oakwood provides to southeastern Michigan, please visit oakwood.org or call 800-543-9355. That's 800-543-WELL. Thank you for joining us, and see you next time on Champions of Care.